Welcome to the Texas Talks podcast. I am your host, Brad Swale. Today, I'm joined by Travis McCormick. He's the founder of the Make Texans Healthy Again movement. Travis, how are you doing?
I'm doing well, Brad. How about yourself?
Oh, I'm doing great. I'm feeling healthy, and it's a pleasure to speak with you. Health has always been a passion of mine. My family background and everything like that. It's a perfect alignment. So I'm really excited to talk to you. Uh, I couldn't have given you a briefer intro. Who are you? Give me some more background.
Yeah, my name is Travis McCormick, and I have worked kind of in and around the political sphere for about the last 15 years. And essentially, last December, I decided to start this movement because I think we're having a moment in this country, especially with the national Make America Healthy Again movement. And I didn't want Texas to miss out. So launched it. I don't claim to be an expert on healthcare policy, but I do see a lot of problems, and I do feel like I'm an expert at navigating the legislative process. So I felt like it was a good opportunity for me to just kind of go through and analyze all the bills, see what folks are filing, and B, kind of just coordinate and try and gather an army of volunteers to go fight for these issues at the Capitol.
I am I'm personally friends with some people that I think have worked with your organization, just totally happenstance, not because of this, just they're in the health community here in Austin and they want to go and they like a lot of the stuff that's happening with the Make Texans Healthy Again movement. So it seems like that is happening. A lot of volunteers are up there trying to get stuff done. Why are you an expert in the legislative process?
So I have basically spent the last 15 years working the session, whether that's as a staffer. I've worked both in the House and Senate, or I worked at the Railroad Commission as a chief of staff for an elected official over there. So I kind of helped navigate the government relations over at the Capitol during that time. And then last session, I broke off on my own and started doing government affairs and communications for various companies and causes, and really kind of was able to learn it from that aspect. So I felt like since I'm already up here every day talking to people working on stuff for my clients, I might as well just add in some additional issues to track and start having some of these conversations on something I'm really passionate about and feel like we can make a big difference here in Texas.
Yeah, for sure. The more I learn about the legislative process here in Texas, the more I learn that people like you are very valuable in figuring out how this stuff gets done. So you're right. There is certainly a national movement with RFK Jr. and the Maha movement. And it's great that I think that Texas is maybe one of several states. I think that it's happening across the country, and that's I think generally good when you look at the stats of health in America, what the obesity epidemic, healthcare costs, all that stuff. I'm wondering, is this, as you've sort of gotten involved with this over the past, let's say, year or so, maybe a little bit less, do you find this to be a left versus right issue? Is that popping up some, or is it but shouldn't be? What do you think of that?
It's kind of a really interesting issue in that it makes a lot of strange bedfellows. I would say, there are a lot of traditional conservatives in the movement, but there's a lot of traditional liberals in the movement as well, and a ton of libertarian kind of leaning folks that just care about the quality of our food and really just kind of taking on the larger establishment that has kind of called all the shots for the last 50 years and run the stats into the ground. I mean, as you kind of stated, 42.8% of Americans are obese right now. And that rate has tripled over the last 50 years. So as a result, 77% of Americans aren't eligible to serve in the military. And chronic diseases are now causing 7 out of every 10 deaths. So, I mean, I feel like, these numbers are just so clear that there's a big problem that it really is bipartisan. I think there is a slight, some people think this is now kind of a Republican deal because RFK, is now part of the Trump administration. But what I tell folks like that is, he's a Kennedy. He's been a Democrat his entire life. It really kind of shows how bipartisan this is, that he was able to team up with Donald Trump and really kind of create just this entire new movement that brings in people that traditionally don't chime in on these issues in a way that we can actually make tangible differences.
Yeah, if I'm not mistaken, I don't think he pulled a Tulsi Gabbard and switched parties. I think he's still a Democrat. He maybe considers himself an independent, but you're right. a Kennedy and always been and has always been a Democrat in the past. So why, here in Texas, well, actually, before I get to that, you mentioned, the people that have been calling the shots for the past 50 years. Give me an idea of who those people are.
Well, I think, when you're talking about political and government issues, everyone thinks, okay, big government's the problem. And
Sure.
yeah, it definitely is. But I'll also say it's not just government, it's just big systems. I mean, when you look at any issue, it's whenever something gets so big that the individual is just a number on a spreadsheet. So whether that's big pharma, big food, big business, big tech, I mean, kind of the crux of this movement is to just let's start considering the individual. Not everything should be one size fits all. And we've seen, those of us that kind of drift from the mainstream when it comes to health, we're having just tremendous health outcomes. I mean, I've lost, 80 pounds over the last few years. And, just finding a physician that's more holistically minded really was able to solve a whole crux of health issues. And I now just feel like my brain works 10 times better. I'm able to get so much more done during the day. I'm able to be present with my daughter when I'm off work. Just the benefits are just incredible. And I just couldn't sit on the sidelines anymore, knowing that so many people are probably living in this brain fog and don't even know it. It's almost kind of like breaking out of the matrix, if you will.
Yeah, for sure. So the national movement, Make America Healthy Again. Now you've got Make Texans Healthy Again. What are the implications for Make Texans Healthy Again? What's the state of health in Texas? What are the short-term and long-term implications, whether this fails or doesn't fail? Like, if it goes great, what can we expect? If it doesn't, nothing happens, which I don't think will be the case. If nothing happens, where are we going?
Yeah. So, if nothing happens, it's just going to continue to be status quo. I think we'll continue to see, incremental improvements within certain classes of people, people that are chimed in and paying attention to the things because it is, just popular in the cultural lexicon right now. But if we are able to make just a real radical change at the state level, I think we'll start to see a turn in the rise in chronic disease. And I mean, in the last 20 years, Medicaid spending in Texas has tripled. Spending a little bit more on the quality of our food and what's in the food and reducing sugar intake and things like that will have a tremendous impact on driving down costs on the back end. So, I mean, it is honestly fiscally conservative to spend a little bit more on the front end on prevention, because we are spending incredible amounts of money and it's growing every single year on the back end by doing nothing.
Yeah. So in Texas, yeah, I don't know what the actual numbers are, stats are. You mentioned the obesity. You mentioned specific numbers on the obesity epidemic across the United States, and
Mhm.
the increased Medicaid spending here in Texas. I think threefold over the past how many years?
Over the last 50.
The last 50 years. Uh,
Mhm.
I mean, my understanding is that Texas is generally not one of the healthiest states. Maybe there's pockets, Austin or some other places around the state, but overall, as a state, I think we have relatively high obesity rates, diabetes rates, um, heart disease rates, stuff like that. Is that true?
Yeah, absolutely. And it's kind of hard to break off, the Texas specific stats because most of this stuff is
Sure.
tracked nationally. And I mean, that's kind of why one of our, priorities this session is getting a comprehensive study done here in Texas. It's a bill filed by Senator Charles Perry and Representative Joanne Schaffner to go look back 50 years and try and pull Texas specific data on all of these chronic diseases, on how much healthcare spending has gone up, insurance, both private and public, looking at how the food's changed, both, in our grocery stores and through fast food, and just putting together just a simple report that has some graphs and some numbers so we know kind of our baseline here as we go try and shake things up and change things.
Yeah. Wouldn't that be a lot of that already sort of be available? That sounds like an easy, I've never done something like that. So don't,
Yeah.
I'm not, I'm not an expert in
I,
this.
I don't think it's rocket science to go pull this. I think all this data exists somewhere. But I'll also say that I have probably spent 20 hours trying to pull it all together, and it's just so piecemeal
Yeah.
that I think it will take the force of government to go in and go in and say, hey, we're going to need all this information. And yeah, all this information should exist. And where it doesn't, I give them the ability to use national data as surrogate numbers anyways. And just having this just as a baseline will really improve you know, this whole thing. Because I mean, how do you solve what you can't measure?
Yeah, of course. You have to know where the numbers are to sort of know where to begin, where to focus, and what a good job looks like.
Yeah.
You can't you can't just wing that sort of thing. So I think that you guys there's my understanding is there's a Maha study that's either going to happen or has happened. Is that what?
Yeah,
Go ahead.
it's a bill that we have filed by Senator Perry and Representative Schaffner. It hasn't been set for a hearing yet. I'm continuing to email and kind of work committee members on that committee. But my hope is here in the next couple weeks it'll get heard in the Senate and we're able to pass it out of there quickly and kind of get it over to the House.
Yeah, and that study is what we're talking about here, trying to figure out what's been going on, how the health of Texans has changed over the past 50 years or so.
Yes.
Okay, cool. All right. So, I mean, other than that, I mean, there's obviously a lot of bills going on. And as I've looked through sort of y'all's priority lists of bills that y'all are focusing on, it looks like Representative Lacey Hull is almost maybe she's at the forefront of a lot of these, it seems, which is, I think, pretty cool. I've spoken to her
Yeah.
in the past before on a different setting. And there's a lot in here, eliminating harmful chemicals in schools, banning glyphosate-based herbicides on school grounds, and prohibiting schools from, serving meals with artificial dyes, Red 40, the different reds or something like that have been in the media crosshairs recently. It seems like schools are a prime location for implementing a lot of this, something that no matter what side of the aisle you're on, I think that you could get behind, probably, right? Improving
Yeah.
school health. Um, is there, I mean, is the school chemical stuff, the improving school children's health, is that sort of the easy lift of all this stuff?
Yeah, I think it's one of the easier ones. I mean, it passed nearly unanimously out of the Senate a couple weeks ago. I think it had one no vote. And it's yeah, it's just common sense. I mean, when you're doing it for something that's using taxpayer dollars that impacts children, it's a lot easier to justify. And I think it's a good test case for hopefully expanding this down the line. Obviously, people can buy what they want with their own money, but
Sure.
anything we can do where government has its fingerprints and is subsidizing it and is paying for it, I think we should expect a higher standard. I think next session we'll kind of look to expand some of that out to hospitals. Why are we spending all this money getting you better, and then I mean. I've been in the hospital a lot with different family members, and you're ordering sodas, and the food is less healthy sometimes than what you get at a fast food restaurant.
Yeah.
So, um, I think that's probably the next logical step. But right now we're working to get it out of the schools.
Yeah, I think that you could go to any hospital in the state and find a vending machine at the very least, with all sorts of junk just ready, there for $1 for anybody that needs it, or wants it, I should say. You don't need that stuff. So, looking at this list, there's, a little bit more than 10. I think there's 15 or so different bills that you guys are following. Are there some um, that you personally are more excited about than others?
Yeah, I mean, the school lunch bill is a big one. Colcourse Making Texas Healthy Again bill. It's also a Lacey Hull bill in the House. I think that's going to be huge. It requires nutrition education for doctors. So if you're a medical student, you have to at least take a semester. And if you're doing your continuing education as a doctor, that's got to be a component of it. I think that's pretty common sense. Nutrition is what leads to a lot of these diseases. These doctors, whether, it's something they're having to use in their day-to-day practice, they should at least understand it.
Yeah,
And getting the continuing education will make sure that as I'm sure you and I have both seen in our lifetime, what constitutes healthy food has changed and is always a matter of debate. So it's good
sure.
for them to get that update. It also prevents schools from taking away PE as a punishment. So I mean, you have a hyperactive kid that's acting out, you take away their ability to run around and wonder why they're still misbehaving in class. So
I mean, maybe I think you and I are probably of similar ages. Back when I was a kid, I think it was you did more laps when they punished you,
yeah,
which,
yeah, for sure.
maybe that's bad in the other way. You don't want them to associate exercise with punishment, but then again, you also don't want to take it away as a punishment. Is so kids should just have exercise is maybe the lesson here, just every single day.
Yeah, I mean, and we know just generally that kids aren't necessarily getting this outside of school, so this may be the only time they're moving around in their day, and I think that's just essential, especially where 80% of Americans currently aren't meeting physical movement guidelines. Getting that in place at a younger age and creating those habits, I think, is essential.
Do you have those movement guidelines handy? Like, what are they?
I mean, I think it's pretty simple, like going for a walk every day type deal. I don't
I
have
think
them
it's.
on.
I mean, I don't have it off the top of my head either. I think it's like 10. I think the 10,000 steps and 30 minutes of light activity or whatever, right? I
Yeah.
always think when I see guidelines like that, I always think it's such a low bar. I can
Mhm.
understand why some people don't get it. I can understand the logic behind it. I know that they still time to get it, but for kids especially, making sure they have that time to just build the foundation of health and wellness and basic fitness as they get older. If you lose that as a kid, it's really hard to get it as an adult.
Yeah, absolutely. And I think walking is so much more beneficial than people give it credit for. In the fall before, we kind of got crummy weather and, I was going on a walk every morning with my daughter, just pushing her in her stroller for 30 minutes or so and getting that kind of first early morning sunlight. And I really felt like it helped set my circadian rhythm and really kind of improved my mood, and it made my sleep a lot better. And I've kind of, now that the weather's turning, I've been trying to do that on the days I don't have to be up at the Capitol at 7 a.m. But yeah, I think there's something to just, walking around. I mean, our ancestors did it for millennia. Like we're meant to move as human beings.
Yeah, for sure. Uh, so there's a couple of these bills are, I don't know if they're in response to the nationwide issues that we face, like, the egg prices going up. There's a bill allowing expanded local egg sales.
Mhm.
I'm not sure what
That's
the,
probably more based around having quality local eggs that aren't
yeah,
necessarily gone through all the pasteurization and stuff that's required to go into a store. But
nothing to do with the egg prices, just better eggs.
yeah, better eggs. Yeah,
Well, good. Well, everyone
yeah.
wants better eggs for sure. But also, and again, I'm sort of filling in gaps that may not exist, but expanding cottage food businesses, lifting restrictions on home-based food businesses by increasing or eliminating income caps, et cetera, et cetera. It's more than just improving the health through, yeah, better eggs, maybe homemade local foods, but
Mhm.
also giving the opportunity for people to, try out entrepreneurial endeavors.
Absolutely. I mean, this empowers the small guy almost completely across the board. That's something I really like about it. I mean, I've met so many, small business owners. I'll sometimes go over to the farmers market and hand out flyers on a Saturday morning when I've got a little extra time, and just kind of talk to them about what's going on at the Capitol, and they just seem excited about it. And I think for too long the big business has had the entire voice at the Capitol, and we finally kind of have a voice for consumers now that we've started this organization.
Yeah, for sure. The pharmacy benefit managers, which is something that I had no idea really what that was uh, until recently. I think it was one of the means, Callie or Casey Means or somebody else was talking about it somewhere, and I learned what these people are. And so there's a bill to increase transparency and accountability for drug prices by, I guess, regulating the pharmacy benefit managers. What is a pharmacy benefit manager, and how would this work?
They're essentially middlemen that drive up the cost of our drugs. It's supposed to be kind of more of a consumer protection, but what ends up happening is these pharmacy benefit managers are owned by, you know, the insurance companies, and the there's these little fees that get tacked on that aren't allowed to be passed on to the consumer, and the pharmacist doesn't get it. So it's not like the small business owner is benefiting from this. It's just money being wasted that could be applied to savings for consumers.
Yeah. Yeah, and that's it's sort of a hidden fee, a hidden reason why pharmaceuticals are so expensive. So that'll be good to hear. I'm on a state level, I guess that makes sense. But I wonder also in some of these cases if this is not something that would need sort of federal action.
Yeah, I mean, we're saying with, ones that are operating in Texas. So, I mean, I think, some of these companies do operate in multiple states, but they're just gonna have to adjust their practices to deal with one of the largest economies in the world if they want to
Yeah,
operate.
for sure. I think it's the fifth largest, right? And this is we'll get on to I want to talk about the soda controversy that's brewed up over the weekend. But before we get there, there's one that AI healthcare denials that I thought was didn't even realize. I guess it kind of makes sense. We always talk about, I read stories about people getting some health data, some reports back from their doctor. The doctor gives them one thing, they go to whatever AI, Chat GPT, something like put it in, they get something else, and they don't really know what to do. People are going to be using AI for medical reasons going forward. I guess
Mhm.
it never really occurred to me that it could happen on the other end, that insurance could use AI to deny you. And maybe this is what the Terminator was trying to save us from, is AI denying healthcare. But what is that currently happening now? Are insurance companies using AI algorithms to deny healthcare?
Yeah, I mean, if you Google it, there's a lot of stories of that happening. There's been some lawsuits. I think, undeniably AI is going to be something that all businesses use to increase efficiencies, but and I mean, I've used it to sift through massive amounts of data. So, I mean, being able to use AI to create a justification to deny a benefit that somebody rightfully has so they can't get the healthcare that they need, even though they're paying for insurance, is just wrong. And this ensures that the human aspect continues to play a role in the acceptance and denial of claims. And hopefully this bill will get through. Senator Schwartner heard it in committee a couple weeks back.
Yeah.
It seems to be moving. So.
Well, good. I don't, I like the idea of AI, but it seems like there's just a lot of use cases that it's not going to be, that I'm not going to like. And maybe that's just the way, maybe I'm just being a Luddite. So let's talk about the SNAP benefits for sodas. I believe Senator Middleton introduced a bill, that maybe did other things as well, but essentially, correct me if I'm wrong, the controversy is that people on SNAP benefits, food stamps, colloquially, could not use those for buying sodas and other sugary drinks and maybe some candies and stuff like that. Is that correct?
Yeah, I
Yeah.
mean, it's completely about candy, sodas, junk food.
Yeah.
Nothing that's banned in that bill has any sort of nutritional value. I wouldn't even call it food, if we're being honest.
Sure.
You know, I'm not supporting something that's banning, people on SNAP from eating something I would eat. Everything on that list, I don't consume,
Sure.
and I think taxpayer dollars. It's not saying people can't consume it. It's just saying that our taxpayer dollars aren't going to subsidize it. And
Yeah. Yeah.
yeah, and
Well, there was a big controversy on social media over the weekend where a lot of, let's say, conservative political influencers, did they get paid by big soda, Pepsi, Coca-Cola or not? I don't think that definitive proof has come out, but it looks like that's something like it was happening. A lot of conservative influencers were making very similar posts saying that something like this, maybe not Texas specifically, but on the national level, something like this would be, too much government. It takes away people's autonomy or accountability, allowing people to purchase and consume what they want. They referenced the New York City previously trying to ban certain sodas of certain sizes. I think it was back when what was it? Bloomberg, I think, was mayor. And I wonder what you think of all of that. Why do you think that's happening? It's just sodas and SNAP benefits. It seems like a non-controversial thing.
it should be non-controversial. And I mean, to conflate limiting sizes of, draft soft drinks at gas stations and convenience stores that are being purchased in the free market with private dollars, with the government paying people to go purchase candy and sodas. So soda is the number one most purchased item on Snap.
Oh, wow.
Uh, and I saw some study, I'd have to go look at the exact numbers, but that children who are in families that utilize SNAP drink like, it was like 25 or 30% more soda than children that aren't.
Yeah.
So we're literally subsidizing people to be less healthy, and then they're going to have to use the healthcare system more, which is going to cost the state more. And it just doesn't make any sense. And I think the argument people make is, what about food deserts? There's a lot of rural towns that just have a Dollar General. And as someone that's ran a lot of campaigns and been pretty much to every county in Texas,
Yeah.
but that is true. There are a lot of counties that just have gas stations and Dollar Generals, but I will say they have, SNAP also covers rice and canned goods and, fruits and vegetables. And there may not always be fresh fruits and vegetables there, but there's something. And if a store knows that they can't sell this to people on SNAP, and there are folks that have a SNAP card in their county, the market's going to adjust, and they're going to start carrying some stuff that's a little bit healthier that folks can buy with their Lone Star card. And if we don't do this, it's just going to be status quo, and we're going to continue to subsidize it on the front end and then subsidize it on the back end.
Yeah. It seems, like I said, it seems like a no-brainer that the neediest among us may need, you know, to, if we're going to give them, if they're going to receive benefits from the state, that they should, be receiving the best benefits. And a dollar spent on a Coca-Cola versus a dollar spent on an apple, I think everyone, without going to, a semester of MD nutrition school or whatever, I think people just intuitively know an apple's a better choice. And, water comes out of the tap. They can get that for free if they're thirsty. It really does seem like a no-brainer. So it seems like there's a groundswell of support here. And
Yeah.
I referenced it a little bit earlier. I know people personally that are really excited about this movement have gone to the Capitol to speak in favor of a lot of these bills. Why do you think that groundswell of support is there? It seems pretty organic.
Yeah. Well, I think it's because health is so personal, and everybody has a personal story to tell on this of how they've been impacted, whether it's, having some sort of chronic disease or some weight loss journey, or having a loved one die prematurely from something that was completely preventable just because of lifestyle issues. And I think when stuff like that happens, people get passionate. Some of it's about health freedom, parents being told that they don't have any right to determine what medical procedures on what timeline their child will be able to have. There's so many different buckets within MAHA and Make Texans Healthy Again that there really is something someone can support, almost anybody. As I tell all of our volunteers, you're not going to support everything on our list, but let's find ways to work together on what we do support. And it's been great, just seeing the enthusiasm up at the Capitol. I work on a lot of issues, and I have not gotten a call on anything more than this from reps and senators. Just people texting me, calling me, asking how can they help. We got within 1 week, we had 27 people join the newly formed Make America Healthy Again caucus in the Texas legislature. Carrie Isaac is the chair of that caucus and really kind of hit the ground running recruiting for it. It's got members of both the House and Senate, and it's bipartisan. So, it's pretty incredible. I think they're going to be having their organizational meeting soon, setting bylaws and really figuring out how they can chime in and let their colleagues know when these issues are hitting the House floor.
Would that be an indication that this is more than a one session deal?
Absolutely. Look, I'm not like trying to, I think there's a big problem with organizations that get started to solve a problem and then exist indefinitely just to justify their existence. That's not what I'm trying to do here.
Yeah.
But I do know this problem isn't going to be solved overnight, and I'm committed to at least playing my role for the foreseeable future until we start to make some progress on this, and maybe I can pass it along to someone else with some fire in their belly that wants to take it and run with it too. I'm fully this. What I think when I think of this session, I think of it as the proof of concept for something much larger. This session, we were largely with the exception of the study bill that I mentioned, we were just supporting ideas that came up organically by other members. I mean, these weren't things we asked people to file. I was just following what was being filed and then offering support and trying to get things set for hearings quicker. Because they fit these buckets. And I think being able to brand it within the Make America Healthy Again movement has really helped things that traditionally might not have moved start moving faster because it's now a popular political issue.
Yeah, it definitely is. I mean, the just an example like the Red 40 or whatever. I mean, there have been, and I affectionately call them this, but like crunchy moms. I grew up in that sort of industry and that those communities screaming basically into the void that this stuff could be harmful and nobody's listening, and they sort of get brushed off at the Capitol or by their doctor or whatever. And now there's power behind it and there's movement happening. So I think that's also part of the excitement that this is garnering. Well, Travis McCormick, the founder of the Make Texans Healthy Again movement, is there a website or social media that you wanted to plug?
Yeah, absolutely. I mean, if you go to maketexanshealthyagain.com, there's a ton of resources there. There's a bunch of tabs. If you click legislation, we've got our legislative priorities, some one pagers for some of the bills we're supporting. If you click news, there's literally I basically write a newsletter every week going over everything we've done the week before and what hearings are coming up next. So you can go kind of get caught up on what we've done and then go sign up and you'll get I'm not going to spam you, but you'll get an email probably about once a week, about what's going on last week and what's going to happen during the next week. And if you're able to come volunteer and testify on some stuff, we'd love to have your help.
Yeah, well, we'll put the links down for that down in the description below. Travis McCormick, thank you so much. I appreciate it.
Yeah, I appreciate your time.